if you're having problems with daily activities, or if you're having deformity. Those are basically the two indications to proceed with knee replacement. If your knee's getting crooked to the side or contracted, you can't get it out straight, you can't flex it up, we consider that deformity. So it's basically pain above and beyond what you can tolerate with routine activities, or deformity are the two indications to start talking about having your knee replaced. We get down to the knee, and then it's a series of guides and jigs that allows us to put a cap onto the femur and a tray on the tibia. So it'd be cobalt chrome and titanium components on the femur and tibia, then a highly cross-linked polyethylene or plastic on the back of the kneecap and on the tibial tray. So basically your joint surface or cartilage now is metal on plastic. There's just not that painful, worn out cartilage and bare bone that are rubbing together.